My name is Stacy Finkbeiner, and I'm the U.S. Medical Director at Teva Pharmaceuticals, focusing on movement disorders in psychiatry. The study that we conducted was aimed at conducting a survey with individuals living with tardive dyskinesia, in which we surveyed 269 people living with tardive dyskinesia, or TD. The survey was designed with input from clinicians as well as patients and caregivers to ensure that the content was relevant for those with TD. And what we really wanted to assess, and the main research question, was really to understand and characterize the multidimensional impact that TD has on individuals living with TD. We focused on 4 domains of impact. So looking at the physical aspects, the psychological, the social, as well as vocational or effects on employment. And we posed a series of questions in which we asked respondents to provide one of 5 responses. So indicating for a specific example of the potential impact of TD that it never or very little applies to them, it rarely or a little bit affects them, maybe sometimes or somewhat affects them, versus maybe somewhat often or very often. And within this survey, we had about 50 different items. So when we conducted this survey to really collect the multidimensional impact of TD, what we found is that with this list of roughly 50 specific examples, most of the examples that we provided, a majority of the individuals living with tardive dyskinesia said they were at least sometimes or somewhat affected by TD with that specific example in mind. And many reported being often or always affected. Some of the key examples with respect to physical impact, for example, were things like the ability to fall or stay asleep, ability to hold things like a fork or a cup, potential speech difficulties. For psychological effects, those included things like feeling sad or unhappy because of their TD, feeling embarrassed, or fearing rejection from others. With respect to the social domain, that included things like they reported limiting their social activities due to TD, whether that was engaging with family or friends or out in public, and reported that TD interfered with their ability to be out in public, whether that was running errands or perhaps on public transportation or things like that. And then with respect to the effect of employment, individuals reported that they experienced impairments while working, so reduced productivity, or they also reported affecting their ability to either get a job or apply for a promotion that they specifically attributed to their tardive dyskinesia. Additionally, we also asked individuals about the underlying treatment and how they managed that with respect to their TD. And what we found was that 48% reported that they chose to skip a dose of their antipsychotic medication because of their TD or stopped it altogether.